So we had a lady referred to us in 2015 by one of our local practices who in Twyford, who had been told by 3 other practices and a dental hospital nothing could be done to help her, which, as you can imagine, for a patient was life-changing. It was devastating that nobody could help her and nobody could give her any alternatives. And I'll never forget the day she came for her consultation and I walked through the waiting room and there was a lady sobbing. Can't have that. Had to go and find out what was going on. And she sat there with her hand over her mouth, barely made eye contact, sobbing her eyes out, going, "I don't know why I'm here, you're not going to be able to help me." Of course we can. We haven't even seen you yet. I'm sure we can do something, not knowing any of this history. She was booked in with Dr. Desai, our principal dentist, and who carries out all our implant treatment. So I actually went in with her and I said, "Look, do you want me to come in with you? Because you sort of met me. Please, that would be lovely, that would be lovely." So we went in. This poor lady had a list of allergies a mile long, allergic to things that you would only find in certain dental materials, etc. And she had very, very broken down teeth. She had rampant gum disease and was fully aware of that, but knew that she needed to do something. She couldn't eat, she would walk around with her hand over her mouth, she wouldn't go into a sort of social settings or anything like that. Jatin sat there, right, let's see what we can do, had a chat with her and said, with the allergies, it's going to make life difficult. That was back in 2015, and over the course of the next 6 months to a year, we worked with product specialists for some of our dental materials, even going back to their main HQ in Germany and talking to their senior scientists to find out if any of these products she were allergic to were in the materials that ideally we would use. We even carried out our own patch testing on her in the waiting room with her agreement. Right, we're going to mix some of the impression material, put it on your arm, bandage it up, and my nurse is going to sit there with the medical emergency kit just in case and see how we go. And she was fine. We were being sent random bits of resin to put under her tongue and sit in the waiting room by our technician, who again was also trying to see what he could do. And eventually we determined materials she wasn't allergic to. And we sat there and we explained everything and we're happy to go along with it. And she was like, I don't know, I don't think I can. And eventually she had full mouth rehabilitation with full mouth implants in a day and upper and lower implant restored bridges. And by the end of 2019, she had her confidence back, she had her smile back, but also she'd completely regained her trust in the profession and in us as a practice, because everybody else had just dismissed her. You're allergic to everything, we can't help you. I'm not going to spend the time to sit there and work out what I potentially can do. You do the legwork to find somebody else. Whereas we turned around and went, let's see what we can do. Let's see how we can help you. She still sees me for hygiene visits, and every time she comes in, I get the first 5 minutes of, I'm so grateful for all the work you've done. I've really tried hard to look after them. I do everything that you said, because she knows the work that we put in to help her. She now wants to reciprocate it and give it back so that it is that team, including the patient effort.